Hi there, Facebook. I wanted to hop on tonight and talk a little bit about the vital force. So I don't know if any of you saw this article. I don't know if you can even see that well, but it is about this model, Lauren Wasser, who had toxic shock syndrome. And I'm curious if you see this. Please comment below if you know of somebody who's been affected by TSS, toxic shock syndrome, bacterial infection. And I'm curious how many people out there know of somebody who's been affected by this, and then also if you know of somebody who's had complications from this. So this one is, I would not say it's overly rare, but if you've heard of somebody, you definitely know. You know that they've been severely affected, possibly even death. And so this article, when I read this, it really made me think of a patient, and that's what I want to share today. So this article, and keep in mind, it's from People magazine. So do I believe every bit of the medical portion of it? Absolutely not. But if this actually happened like this says, this person was a model at the time, 24 years old. She claims that yes, she had a tampon in, but she'd changed it multiple times throughout the day. And fairly quickly, within a matter of, it seems hours, that she felt ill. She ended up getting a welfare check. Her mom called the police, and they basically found her eventually face down on the bedroom floor with 107-degree fever. They put her in a medically induced coma, and now she is a double amputee. And so I'm not sharing this story to highlight the negatives of TSS or to highlight the negatives of tampon use, not at all. I want to highlight this basically showcasing how important our overall immune function is, or as a lot of us naturopathic physicians might call it, the vital force. So this is shared with permission of a patient, and I saw this patient somewhat recently, and she had come to me originally for a vaginal odor. And if that's TMI, you're already tuning out here, but ladies, you may understand if you've ever had that issue before. So she came to me and I said, well, let's work on this. Let's see what's going on. And I would recommend a PAP. And so she came back in and we did a PAP exam and a gyne exam. And she said she had not been using tampons. So that wasn't high on the radar. But there was a tampon in. And I want anybody watching or watching this later, I'm kind of tempted to not tell you so we can generate some guesses here, and then I'll comment later. But I want you to guess how long her tampon had been in. Isn't this a fun game? Guess how long the tampon's been in. Woohoo! But go ahead and comment below, and I think I am gonna just wait a while and come back later and tell you how long this tampon was actually in. And I think you might be amazed. But the whole point of this is here we have this 24-year-old, supposedly healthy, which as we know, she couldn't have been overly vibrant and healthy if, hello, Dr. Tadikin, we know that her vital force couldn't have been functioning at optimal if she ended up with TSS in a matter of hours or a day. She claims that she changed her tampon multiple times that day. But this patient that I saw is very vital. She had no symptoms except odor, obviously. I commented on that one, but she had absolutely, oh, Beth says, I assisted with something like this before. It was shocking. It was in 3 months. Okay, is that your guess? Or are you just saying that's the longest you've heard? So we've got 3 months. Anybody else want to chime in? I know it's dinner hour here in Arizona, so that's why I'm going to kind of leave this up for a while and see who else has been affected by this, or like Beth, you mentioned you've had experience, or was it 6 months, question mark? Either way, it was months, so she's not sure. But even if you have no idea, even if you're a guy, go ahead and chime in and take a guess. So this person had no symptoms except vaginal odor. She didn't have a fever. She felt great, she felt fine, and we found a tampon. So I'm gonna let you ponder that. And when I found it, obviously we took it out, and she was shocked and I was shocked, and we celebrated and everything was dandy. We've got a guess of 1 month, and I'm just gonna say Isabel. I'm not gonna try and pronounce your full name there. Good, they're all good guesses. Beth, oh come on, you can't have 3 guesses here. Now she's going, my guess is 4 months. Go Pack, go. Stinker. But the point is, this person is really vital. She was following a naturopathic diet. She is, I won't give you too much info on her job, but I'll just say she practices a healthy diet and very high antioxidants. She uses a drink that is full of fruits and vegetables, lots of antioxidants. And so for her, she was able to tolerate obviously more than a day. People are guessing months here, or a month. But go ahead and comment below, 1, if you've heard of people affected by TSS, 2, toxic shock syndrome, 2, what your guess is how long this tampon was in. And then I will come back at a later date and fill you in on what went down. And we did a PAP and everything came back perfect, normal. The rest of her tissue actually looked really good, which was a little bit shocking. Besides the odor, she was great. So my point of this is not to gross any guys out there, not to gross you guys out because of this topic, but to educate you that, do I want you to leave tampons in? No. But if you're using tampons, it doesn't matter if you're using tampons or not. You need to boost your vital force. So there's all sorts of ways to do that. Like I talked about with her, diet, lifestyle, her stress is drastically reduced in the last few years, and high antioxidants. So there's all sorts of other things we can do, but I will leave it there. And yes, be aware, because this whole leaving a tampon thing can happen to in tune, intelligent people. I'm telling you, I've seen it. It can happen. Beth, my only guess is the last one. So she's guessing 4 months. Another one guessed 1 month. Trisha, Lorraine, you want to take a guess how long this tampon was in? And without any symptoms except vaginal odor. So go be fabulous. Go eat some antioxidants with colorful vegetables especially, or take a supplement that has great antioxidants. Work on your stress and get some sleep tonight. Get some sleep every night, ideally 8 to 9 hours. And I will be back to tell you how long this mysterious tampon was in. And the really ironic part, I'll leave you with this, is I've known people who've died. A colleague's sister was in a coma for TSS, and I have known somebody else who died from TSS. And ironically, this particular patient's family member died of TSS. So it's kind of freaky. So we can't pull the genetic piece there either, because this person didn't develop TSS. Dr. Young, awesome. Dr. E, thanks for sharing and filling it. Yes. Okay, I'll come back later. Have a great night and post your guesses below.